Hi guys, so here we are in week 3, halfway there. Thus far, we have in week 1 engaged the situation analysis of refugees. In week 2, discussed practices and experiences of these migrant and refugee groups. And emerging from those particular focal points are challenges and solutions in terms of how we can best manage this migrant and refugee scenario, especially in terms of their health. This, therefore, allows us to engage lessons. What are the lessons learned and will continue to be learned to inform the way forward for refugees and migrant health? For the lessons learned, emerging from the burdens, the health burdens in particular, of migrants and refugees, we understand the healthcare situation, whether it's limited or attainable towards meeting the needs of these migrant and refugee groups. Emerging from these particular situations are in fact best case scenarios, practices which we can learn from and apply going forward. Some of the lessons learned no doubt include conflict, displacement, food insecurity, poverty are determinants of diseases, if not the mere fact that you are a migrant or refugee as well. Some complications, including physical challenges, social displacement and insecurity, as well as financial limitations, erodes the lifestyle, the habituation, and indeed the coping mechanisms for persons that are displaced from their country or region of origin. Refugees in particular are often more vulnerable disproportionately when compared to other population groups. These are the known characteristics which creates a problem, and this allows us to respond to some of these lessons that we have learned. The burdens include results or outcomes of war, conflicts, economic challenges, in addition to the fact that the displacement of migrant and refugees resulted in a long, tedious, challenging experience of relocation. The risk of diseases that displace populations inherently carry with them and potentially transmit to their host and destination country include infectious diseases and non-infectious diseases. Some of these regions may have failures in vaccination coverage for the population. Therefore, diseases that are considered vaccine preventable for the host countries may potentially witness an outbreak of diseases including measles, other diseases including waterborne diseases by virtue of limited hygiene sanitation practices, other infectious diseases, tuberculosis, spread through densely populated communities, hepatitis. The idea is that once you have vulnerable populations in less than optimal living standards, that can encourage and support for the outbreak and spread of infectious diseases. Other examples of diseases include vectorborne diseases, as people themselves may serve as carriers of pathogens. And with the presence of vectors, including mosquito vectors, can allow for the entry and the increased burden of vector-borne diseases. We also have some exotic diseases, especially from countries and regions where refugees and migrants are sourced from, can potentially translocate diseases including Ebola, Marburg virus, Lassa viruses, as well as different strains of influenza, which is happening around the world. Other communicable diseases, including gastrointestinal diseases, dermatologic conditions, can spread within refugee migrant populations as well as the native populations of their destination country. Vaccine preventable diseases is critical, as the native population are considered protected. But in the event of clinical outbreaks of these diseases, then that can lead to a healthcare challenge for the healthcare system to respond to. Bearing in mind that health is physical, mental, and social well-being, we also appreciate the mental aspects of relocation, of social marginalization, and the trauma which led to the relocation and displacement of these individuals. Mental health services is required, and other chronic conditions, metabolic disorders, diabetes. Persons may have uncontrolled diabetic conditions, as well as heart disease and maybe even cancers. Are these able to be managed and addressed? There are in fact limitations. These diseases account for a significant burden, morbidity, and mortality in refugee and migrant groups. Other healthcare challenges include injuries, physical trauma from the travel, from the hazards and risks in the new environment. The forced displacement would have led to loss of medical follow-up, loss of medication, which can serve to create complications in pre-existing conditions. The living conditions itself is degraded in shelters, food quality, food supply, water. These are limitations which can create disease burdens. The interruption of care, infrastructure is compromised. Maybe there are challenges to provide medical supplies to many of these campsites. What about power supply? Adverse weather, climatic events, whether it's too hot or too cold. How can that internal environment and conditions be maintained optimally? These are some stark realities facing these refugee and migrant groups. The lessons that we can apply to the health burdens faced with these groups include triage. It is recommended that at the points of entry, health problems are identified and managed. These persons need to be followed up. Otherwise, the complication will be more costly and, of course, more adverse to the human patients themselves. Persons require diagnosis and treatment with follow-up. This necessary care must provide in terms of specific population groups. Children, pregnant women, the elderly are more predisposed and require these services. Groups that are displaced and relocated should have access to a healthcare environment, including prevention programs such as vaccinations, and when needed, clinical care and management, regardless of the factors, the social determinants which led to the persecution to begin with, such as gender, religion, age, ethnic background. Those were the conditions that led to displacement. They should not remain conditions in the destination country that people are denied basic rights and opportunities. Generally speaking, the World Health Organization does not recommend for obligatory screening of refugees, as there is a perception that among the refugees themselves, as well as the wider native community, that anxiety may develop. The WHO, however, strongly recommends that health checks be offered at the point of entry. And these checks should be both for communicable diseases and non-communicable diseases. So these lessons are that invariably refugees, migrants will continue to keep coming as a host country. And globally speaking, people will continue to be relocated. Target countries tend to view migrants as another country's problem, such as the countries of Italy, Greece, and Europe. They are landing sites for many of these migrants and refugees. But the target country will be beyond Italy, beyond Greece. The host country, the region, the fact that you are receiving large numbers of migrants and refugees suggests that your migration system is not working. Host countries have been magnanimous as well. And this situation is a crisis situation, a human crisis situation. The fact that migrants and refugees will keep coming is in spite of barriers towards interrupting the pathway of these migrants and refugees. We've had cases of boats capsizing in the oceans and seas, killing hundreds of migrants, but they still keep coming. Remember that these persons are fleeing because of unsafe environments. There's a lot of push factors out of their countries and regions of origin. Even if patrols or walls are implemented, these persons make a choice to escape their current situation. That's a very powerful and strong determination, which will continue the outcome of migrants and refugees streaming in to countries seeking different opportunities. The view that the migrants that enter into one country is another country's problem is because the transit period is observed by many migrant and refugee groups. This transit period is essentially the time that persons will continue to travel until they source their final destination. Sometimes there are many countries in between that pathway. These countries also have little or no experience with this in-transit group of people. The migration system requires strengthening, as the lesson learned clearly is not working. In the European Union, for example, the Schengen zone does not mandate for checkpoints between countries within the Schengen region. However, as a result of the Syrian refugee crisis, France, for example, began employing checkpoints as a strategy to dissuade migrants from entering. This, in fact, is a legal violation of the Schengen rules. So the system of migration requires review and development towards meeting the new challenges as a result of the movements of people today. Lesson 4, countries have been magnanimous. Where within the countries, a lot of xenophobia is developing. In Hungary, for example, the movements of the Syrian refugees led to striking, building of walls and barriers, also evoking some religious type of conflict. The Slovakian government, for example, indicated that they will accept refugees of one particular religious group and not the other. This separation is further dividing persons that are already displaced from their home and country of origin. This scenario is a human crisis scenario. People are fleeing due to fear for their lives. And the countries and regions they are fleeing to is also a source of conflict, of challenges. There are health disparities, there are social inequalities, and in fact, there are generational burdens to come. A lot of effort and attention is essential towards addressing this particular crisis. And this is the focus for Module 3 and Week 3 of our Refugee and Migrant Health Open Course, as we will be discussing the current challenges and solutions. Then that should set the stage for Week 4, Module 4, as we explore the way forward. Look forward to seeing you guys then, and it's goodbye for now.